Hello my friends, my name is Dr. Saeed Kazmi. You're watching my YouTube channel. A quick recap of pediatric asthma. So, definition. It's a chronic inflammatory disease of the lungs characterized by reversible airway obstruction, resulting in difficulty in breathing, wheeze, and cough. Now, the question is, how do we diagnose? Diagnosis is mostly clinical in children less than 5 years of age. So, if there's a history of repeated difficulty in breathing, wheezy chest, and cough, which responds to a trial of bronchodilator therapy, then it is considered to be asthma. In older children, you can do spirometry. So on spirometry, if the FEV1 divided by FVC, that ratio is less than 70%, or if the child has got greater than 12% improvement in FEV1 after administration of bronchodilators, or if the child fractional excretion of nasal nitric oxide is greater than 35 ppb, that is diagnostic of asthma. Coming down to the differential diagnosis. So the differential diagnosis of pediatric asthma includes: number one, if a child has got a repeated history of difficulty in breathing with a wheezy chest and cough, and the history goes back to early infancy, usually, or neonatal time, and the child is faltering on his growth curves as well, think about cystic fibrosis. And with similar history, if a child has got a history of nasal discharge or nasal stuffiness which is not responding, not improving, think about primary ciliary dyskinesia as well. A child who was born premature and has got a history of being on oxygen for some time, and after that he has been constantly wheezy on and off with difficulty in breathing, think about bronchopulmonary dysplasia. Similarly, a child who has got a history of difficulty in breathing, wheeze, and or cough for a long period of time, again dating back to early infancy, and he's not improving on inhalers or any other form of treatment, think about some intrinsic or extrinsic compression of the airways. Like, for example, intrinsic compression can occur in congenital pulmonary airway malformation, or there might be a mass in the form of extrinsic compression on the airways. A child who has got a history of difficulty in breathing, wheeze, and or cough since infancy, and has got a history of vomiting, think about gastroesophageal reflux as well. And a child who has been otherwise well and a sudden onset of difficulty in breathing plus minus wheeze and or cough, think about foreign body inhalation as well. So these are a few of the important differential diagnoses that you should consider in your mind before making a diagnosis or clinical diagnosis of asthma. As far as the treatment goes, there are two types of treatment: treatment of acute attacks and preventive therapy. Acute attacks are managed by a combination of beta 2 agonist, which can be given in the inhaled form or nebulized form. With that, we can add antimuscarinic agents like ipratropium, and the third thing are steroid, oral or IV steroid. So these are the first line management of acute attacks. If the child responds to that, well and good. If not, then further second line drugs are added, like magnesium sulfate and maybe intravenous salbutamol, which is usually given in an high dependency setting. As far as preventive therapies are concerned, the cornerstone are inhaled corticosteroids. So they are always started in a very low dose, and there is always a step up management plan. So if a child is started on inhaled corticosteroids and if he's less than 5 years of age and he is not responding, then you can add a leukotriene receptor antagonist to that. Similarly, if a child is older than 5 years of age, you can either start with inhaled corticosteroid, then add either a leukotriene receptor antagonist, or maybe you can add a long-acting bronchodilator in combination with inhaled corticosteroids. So if they are responding well and good, if not, they have to be referred to respiratory specialist, because in that case, if the child is greater than 5 years of age, they might have to stop the long-acting bronchodilators and increase the dose of inhaled corticosteroids to maximum, or maybe add oral steroids to the management plan. So this was a brief overview of asthma regarding its definition, diagnosis, differential diagnosis, and just the overview of management. Just for exam purposes for your exam coming up, just a refresher for you guys. Thank you very much for listening and watching. Take care. Bye bye.